Community Health Plan Presentation by Tanika Abram, RN. Duluth is a community located in Gwinnett County, which is northeast of Atlanta, Georgia. Duluth came about in 1876 and went on to become one of the leading hubs in Georgia for cotton, shipping, and trade. Every community in Georgia has two sides. Either you're historical or you're not. The historical regions in Georgia tend to be quiet, nicely kept, and without all the riffraff of crime, pollution, or traffic. Over the years, redevelopments have helped bring the economy up in Duluth. Families have moved here to raise their children. Young people have come here to start working. The makeup of the community continues to evolve and has increased by more than 10% within the last 6 years. One of the strengths of this community is its culturally diverse population. Duluth is currently populated at approximately 28,000 residents. We currently have one hospital, 13 schools, 2 colleges, and over 20 nonprofit organizations that are dedicated to serving the community of Duluth. The average household income for this community is about $55,000, which is higher than the national average. According to the policymakers in Duluth, residents in the community have a more considerable amount of disposable income compared to nearby cities, which in result can help with local businesses striving and also to potential to bring up new businesses in Duluth. The reason I chose this community. I chose this community because I live in this community. As a nurse professional, it is vital that we are responding to the needs of our own community. In this environment, I can draw on my professional skills, abilities, and current understandings of my community and help deliver appropriate care and assistance to those who need it most. Though I have only lived here for about 6 months, I have discovered potential weaknesses of the community. One weakness identified was the number of fast food restaurants compared to the number of fresh food markets within 5 miles of resident living areas. Recent studies have shown a connection between fast food consumption, increased calorie intake, and decreased physical activity. The investigations also revealed that more people choose fast and unhealthy food due to convenience, cost, and impulsivity. Another potential weakness observed was the number of gas stations per block in the area. On average, you'll see about 3 gas stations per block in Duluth. The health effects of gas stations within a certain radius of living quarters and schools can decrease the air quality and put the public at risk for long-term effects. There was also a study performed in California, and it showed that youth were more than likely to be exposed to tobacco advertising when gas stations and convenience stores were within walking distance of their living quarters. Youth smoking, influenced by local advertising, has increased by at least 50% within the last 5 years. Another potential weakness noted was the decreased ability for youth to connect to local recreation in the area via walking. Though there are parks in the neighborhood, the distance from everyday living quarters is too far to ensure walking would be safe for children and teens. This is a significant challenge for our youth because if they don't get out and get exercise by walking, they resort back to video games, social network sites for recreation. A walkable community promotes a physical environment. A recent article outlined the future of Duluth. It mentioned some of the information or issues I just discussed. And it talked about how future redevelopments are in place to make Duluth a better place to live. The article also stated that in order for this growth to take place, visionary planning in collaboration with a variety of critical players is necessary. Youth all over Georgia are continuously fighting an uphill battle because they are underserved due to the lack of understanding of available resources and the lack of access to role models that can change their path. The Boys and Girls Club of America is a great organization to partner with because their mission is to provide an environment where teens and children can flourish. Collaborating with the community department to implement neighborhood projects can enhance my public nursing skills and strengthen our community. The first step in my community health plan was complete a windshield survey. Windshield surveys are systematic observations that help you better understand your environment. The windshield survey can be completed from a moving vehicle, walking in the neighborhood. The purpose of the windshield survey is to observe your community at large so that general needs such as economic, physical, and social issues can be addressed. During this process, nurses can look for the presence of healthy behaviors. I performed my windshield survey in Duluth, Georgia. The weather was pretty great. The amount of movement in the community helped me to assess the strengths and possible needs of the community. The windshield survey uncovered that though health disparities aren't evident just from observing the area, there is a preventive need to increase awareness on possible environmental risk factors. From the survey, I discovered that adequate access for youth to freely visit local parks is limited due to inconsistency of sidewalks in the area. The survey also discovered that this area has over 10 fast food restaurants within 2 blocks of the main housing communities and only one fresh food market. Youth under the age of 18 make up 50% of the population in the area. Creating awareness on community influences can help decrease the risk for childhood obesity. The next step in my community health plan was completing a community health assessment. A community health assessment is a process of analyzing a community's health status. This is a core function as a community health nurse and can be completed by gathering primary and secondary data regarding the community in question. Analyzing this information can help nurses focus on the efforts to improve important health needs of the community. Duluth, Georgia is approximately 6,441 acres, and it is located on the west side of Gwinnett County. The city of Duluth handles the necessities in multiple areas of the community. This report will describe primary and secondary assessments of Duluth and Gwinnett County. The assessments focus on the people of Duluth, the community's health status, and the structure of the healthcare system within the community. I will first start off by talking about the number and density of the population. In 1941, the estimated population of Duluth was 600 people. Over the past decades, Duluth has seen periods of enormous growth in population. Within the past 5 years, the population has grown, but at a very slow pace compared to the trends over the past couple decades. The current population is estimated at 28,000 people. The current population is up about 10.3% from year 2010. In 2010, the population per square mile was at 2,661 people. Currently, the population per square mile is 2,936 people. According to Gwinnett's Unified 2020 Plan, over the next 25 years, the population growth is expected to stay steady at a pace very slow due to the supply of land and current age of residents. The outstanding growth over the last 50 years has brought youthful, racially, ethnically diversified populations to the city of Duluth. After reviewing the 2010 through 2016 American Community Survey, I have identified that the median age for residents living in Duluth within the last 5 years is 34 years of age. I also identified that in 2017, 36.97% of the area's population was under the age of 20, and that 12.23% was over the age of 65 years old. The next section in my community health assessment that I would like to go over is going to be the demographic structure of the population in Duluth. In 2017, World Population Review estimated that Duluth's population of white Americans to be 45.18%. It estimated 21.2% to be Black, 22.82% to be Asian, and then 0.9% to be American Indian. The population is also very dense with Hispanics and Latinos. Their estimated population is to be over about 20%. With this racial and ethnic makeup, there is approximately 29.2% foreign-born persons living in and around Gwinnett County. 1,105 people are veterans living here in the area. And due to this diversity, 33% of the county speaks another language outside of English. Okay, so we're going to move on from demographic structure of the population, and we're going to move over to disease incidence and prevalence for leading causes for mortality and morbidity in the area. So the most common disease condition affecting the residents of Gwinnett County is acute conditions, chronic conditions, maternal and infant deaths, mental illnesses, and disabilities in the order of decreasing risk for mortality and morbidity. Acute conditions rank the most common cause of death and morbidity in the county. Visits to the emergency department were the most common presenting areas for people with acute conditions. The common acute condition from data analyzed between 2010 and 2014 included accidents, falls, diseases of the urinary tract system, muscular system, and finally road vehicle accidents. More than 100,000 unintentional accidents were reported over this 5-year period, while 61,000 visits to the emergency department were due to falls. And it was the second most cases for visits to the emergency department. Falls were mostly seen in older people over the age of 65. While there were some accidents resulting in falls in youngers, older people were the most higher population visiting the emergency room for that issue. Violent crimes, homicides, and child abuse were also common causes of acute conditions in the area. The second most cause of mortality and morbidity in the county is chronic conditions. These are diseases which require long-term treatment and usually have a poor prognosis. The most common chronic condition in the area was noted to be heart disease, cancer, and diabetes. Ischemic heart disease and vascular disease accounted for the leading cause of death in Gwinnett County, with a prevalence of 65.4 deaths per 100,000 population. Other leading causes of death were lung cancer, stroke, asthma, and diabetes. Cancer rates in the county are also slightly higher than information or data across the national statistics. However, lung cancer, colorectal cancer, and breast cancer still cause considerable amount of deaths due to the poor social economic factors in the county. Hypertension remains a significant risk factor for the population. Maternal and infant health is an essential aspect of the healthcare in the county because it accounts for about 9% of all admissions into the county hospitals. Infant mortality in the county is be approximated at 5.4 deaths per 100 live births in 2013, which represents an increase from the previous 5.1 deaths in 2012. Mental diseases and disabilities are also common for morbidity in the residents living in Gwinnett County. After talking a little bit about the prevalence of diseases in the area, I definitely want to go on and start talking about the structure of community facilities and also the structure of community healthcare providers. So Gwinnett County is served by Gwinnett Medical Center, which comprises about 464 acute care and 89 skilled nursing beds. The center has 2 healthcare centers which specialize in acute care delivery. One facility is located in Lawrenceville, Georgia, and the other facility is located in Duluth, Georgia. The centers are connected to other outpatient centers in the county, which coordinate with clinicians in providing care. Duluth Medical Center is focused on providing care to local community and residents across the county. Profit hospitals are also present in the county and provide care to residents. There are also many small hospitals in and around the county, and they're offering services as well. We also have specialized center for mental health and substance abuse. And then we also have many providers that specialize in providing our population that speaks outside of English. So they actually focus on those populations. We have providers that strictly speak Spanish. We have providers that strictly speak Asian. The healthcare insurance program has also been implemented in the county. However, the lack of insurance coverage is significantly a problem in the area. There's only about 75% of residents estimated to have insurance in the area. Gwinnett has approximately 58 care providers per 100,000 population, and then also 57 dentists per 100,000 population. Now, despite the presence of healthcare practitioners in the area, low-income residents still are discouraged and do not go to see the primary care doctors or the regular specialists on a normal basis. Medicaid programs are also implemented in the county, with approximately 11% of the county population being Medicaid recipients. Now, going over everything, you first do the community health assessment. That's the first step in your process for your community health plan. I definitely want to go back and kind of talk about some of the information that I did find and basically how I analyze that information. So after careful review of the health status of Gwinnett County, I can definitely see that a rapid, diverse population is growing in the area, and that it has effects on the disease presentation that are currently being managed in healthcare centers. Additionally, social and economic factors such as education, income, and housing are increasingly affecting the health outcomes and need to be addressed in the area. The top priority needs in Duluth Medical Center includes managing acute care medical conditions and chronic conditions. Acute conditions such as unintentional injuries, falls, homicides road traffic accidents are the most common causes of mortality and morbidity in this area. Chronic diseases such as diabetes, hypertension, and cancer are also common health problems faced by the population. The health outcomes associated with these chronic illnesses is dismissal partly due to the health habits of the residents. A large population living in Duluth are unemployed and living in poor housing conditions, it makes it kind of hard to manage long-term illnesses. Secondly, priority that needs to be addressed in the county is the improvement to access to care. Access to healthcare is vital for improving health outcomes, especially in patients who have chronic illnesses. There are only two main hospitals that provide care to people of this county. The residents of Gwinnett County also have low insurance coverage rates, approximately 75% of the population, which means that some of them do not go and get health care needs addressed. Additionally, only about 11% of the population receives Medicaid. This is shocking, very shocking that the statistics support evidence of poor health outcomes observed in the community, and that there's currently prevention programs available in the community. So to help curb this issue, I definitely want to start working towards a diagnosis and talking about ways that we can help prevent this population from getting chronic conditions such as hypertension, diabetes, heart failure, because they're one of the leading causes of mortality and morbidity in our country. Before we start to talk about the diagnosing and diagnosis, I want to talk about the support that we have in the community, as well as community partners, as well as community resources. So we'll go over that and just talk about what we're going to do to get some support from some of our community leaders and organizations so that we can be able to exercise this problem and fix the issue that's going on. So the Affordable Care Act was enacted to improve health outcomes by improving accessibility and providing affordable health care. It is worth noting that these healthcare reforms are key to improving the health status of residents in Gwinnett County. In managing the rapidly growing and diverse population, the health sector should focus on training more nurses who can meet the demands of the changing population. An adequate nursing workforce is required in the county to coordinate care, promote health, and educate the people. The county should also focus on improving emergency and trauma services and managing acute care conditions, which have been proved to be a significant burden causing mortality. The county should also focus on improving access to healthcare by collaborating with community providers and organizations and bringing services that are close to society. Additionally, education programs should also be implemented to create awareness on programs such as Medicaid and health insurance programs to improve access to care. This will ensure that more people are covered and seek medical treatment. Prevention care is also crucial in lowering the incidence of chronic illnesses. As healthcare system transforms, focuses on preventive medication and collaboratory care with community organizations to detect and prevent chronic conditions together is good for promoting good health practices. All these interventions can be adapted to improve the health status in Gwinnett County. Management of acute conditions, improving access to care, and preventive care on chronic conditions can remain a key priority to improving care delivery in this area. Community partners are nonprofit organizations whose role is to offer grants, support, expert advice, and services or solutions to problems faced by the community. Duluth, Georgia has several community partners who work closely with the county to solve problems of imbalanced nutrition, especially amongst our vulnerable populations. One program that is geared towards helping this population is the WIC program. The WIC program is a nutrition and breastfeeding program which helps mothers, pregnant mothers as well, newborn babies, and children stay healthy and feel well. The program offers education and counseling about nutrition practices and appropriate foods to these groups. Additionally, there are special programs such as the Supplemental Nutrition Assistance Program, also known as SNAP, which provides food to low-income earning families in the county. Women and children are vulnerable to imbalanced nutrition in the society because increased nutritional requirements for their growth. Another community partner that helps to solve the problem of health issues is Georgia State. Georgia State, through the Department of Public Health and Agriculture, has helped at protecting the health of the people in the state of Georgia through nutrition and physical activity promotion. Another community partner with the mission to improve well-being and resources to our community is the Boys and Girls Club of America. The Boys and Girls Club of America is one of many organizations in this community dedicated to ensuring that children and teens in this area are living a healthier life by eating a balanced diet, becoming more physically fit, and engaging in healthy relationships. In 1860, the Boys and Girls Club of America became a place for hope for women and young boys. When this club first developed, the goal was to capture a young boy's interest, improve their behavior, and increase their overall personal expectations in life. Over the years, the club has evolved and has incorporated young girls, and now has over 100 years of providing hope and opportunity to young people across the country. These measures are taken to reduce the incidence of chronic conditions in the state of which significant health problems amongst these people, especially in Duluth County. The Public Health Department has also set guidelines and recommendations for citizens on eating healthy patterns and limit consumptions of other foods such as saturated fats and salts. This advice or nutritional information. Community resources. Community resources are assets that can be used to better the quality of life in individuals in the community. Duluth, Georgia has several human resources that can be used to deal with the problem of risk imbalance of nutrition. First, Duluth is a business county with a diverse and robust economy which provides job opportunities for people in and around the community. Career opportunities help improve the financial stability of our citizens. Lack of income is an economic factor that causes risk of imbalanced nutrition in our community. Presence of jobs can help mitigate this health problem. Additionally, Duluth, Georgia has several hospitals which provide medical services to individuals who live in and around Gwinnett County. Access to health service is essential to manage medical conditions that cause risk of imbalanced nutrition, such as cancer, gastrointestinal diseases, and among other conditions. Imbalanced nutrition, more than the body requirements, is a state where one takes in more calories than their body needs to meet. The human body requires energy to function, and that comes from food. Imbalanced nutrition can put you at risk for conditions such as obesity, hypertension, diabetes, and heart failure. Okay, the risk related to this basically is lack of healthy food options, lack of sufficient walkable sidewalks, and lack of accessible transportation to recreational areas that promote physical activity. Now that we went over the windshield survey and the community health assessment, we're going to start working on the community health diagnosis. The identified nursing diagnosis for this community is going to be a risk for imbalanced nutrition, more than body requirements, with the possibility of intake and nutrients that exceed metabolic needs among residents in Duluth, Georgia. The risk is related to the lack of healthy food options, the lack of sufficient walkable sidewalks, and the lack of accessible transportation to recreational areas that promote physical activity. The objective is to partner with the Women, Infant, and Children Program, also known as the WIC program, to provide adequate calories and nutrients to vulnerable populations. The goal is to prevent risk for imbalanced nutrition among these groups because they are highly vulnerable to be affected. The requirements of the partnership are that the program will only be implemented on pregnant women, infant, and children below the age of 5. Constraints identified as the possibility of not being able to meet the needs of the partnership because the lack of adequate income to implement the program. Evaluation of the progress will go through a human assessment process every 3 months. This involves the measurement of weight, height, and body mass index in adults. The outcome will be evaluated by surveillancing the body mass index for specific ages, and in infants, a pediatric chart will be used, while in adults, a maintenance of normal body mass index between 18.5 and 24.5 that will indicate the outcomes. Disease incidence among these populations can also be used. The outcome will be accomplished with the provision of special supplement nutrition such as folate, calcium, and calories for pregnant women. Vitamin supplements for infants and children as well. The logical steps the partnership should take will first be to identify the problem. So we've come up with the problem. The problem is that these populations are at risk for imbalanced nutrition, more than body requirements. The next thing will be to come up with a solution. The solution will be to educate the community, mobilize groups, and then implement a program. The relevance of this objective is so important for this community because imbalanced nutrition, more than body requirements, is a common issue amongst the groups in this community. Timing of this objective is right because there are more cases of preventable imbalanced nutrition, more than body requirements, being seen in the city and surrounding areas. Also, the community has the necessary resources to accomplish the objective, such as nutritionists who will facilitate education programs to help and make sure the residents know how to properly eat what is considered a high-calorie diet and a low-calorie diet. The economy in this county is good, meaning financial ability is there, which makes the community safe economically. Hospital centers are also there to provide services, so it should not take more than 3 or maybe 2 to 3 years to accomplish this objective. During this period, we will take the opportunity to analyze the changes in growth and reversal of conditions that may have led to imbalanced diet, the rationale for the measurement of human data, in the risk of imbalanced nutrition is to act as a baseline to help determine the presence of risk for chronic conditions. Additionally, to establish the basis of determining the consumption of healthy diets and the continuation of healthy body weights. Along with the intervention to perform biometric screenings every 3 months on women, infant, and children less than 5 years of age, I will also partner with Gwinnett County's Parks and Recreation to host the ongoing free bi-monthly health screening. The health fair will focus on reducing the risk for imbalanced nutrition more than body requirements by promoting healthy behaviors through proper nutrition, physical activity, and healthy weight. Local partners will include community health nurses, nutritionists, physical fitness trainers, and translators. The physical fitness trainer will be providing tips on how to stay physically active in our community without paying high gym fees, and then also educating the residents on proper body mechanics to prevent injury while performing physical activities. The community health nurse will be providing blood pressure screenings and educating residents on how to identify normal blood pressure readings. Blood pressure monitors will be donated by the local pharmacies. The nutritionist will be performing height and weight checks to help residents understand their body mass index. The nutritionist will also provide education on how to choose nutritious food options, healthy meal tips, and reputable websites that can offer education and affordable individualized meal plans. The translator is responsible for relaying educational information to our Spanish-speaking population, since they make up more than 30% of the vulnerable populations that reside here in the community. The community will be notified of the health fair through local county websites, the local radio stations, and our local one-stop magazine. Now, this magazine is managed by the local health department and is delivered to every resident throughout the county. The magazine provides opportunity for residents to aid in improving their well-being. Gwinnett County Parks and Recreation will also donate the time and space to hold the monthly fair and provide exposure of the event by posting flyers in and around their organization. Each intervention success will be evaluated separately and then joined together to determine the goal and see if the goal has been met. We will start off by partnering with Gwinnett Medical Center Duluth. They will provide us with a baseline data that will help us to understand the current impact of residents that are currently diagnosed with imbalanced nutrition more than body requirements. This will give us the ability to monitor this data for increases once our interventions have been implemented. The intervention of providing the WIC program participants with the nutritious food options on a monthly basis to decrease the risk for imbalanced nutrition more than body requirements will be evaluated by the results of the biometric screening that is performed every 3 months. This will help us to determine the success of the program and how beneficial it is to the population. The results of this data can also bring exposure to outside organizations willing to donate funds to a great cause. The intervention of providing free bi-monthly health screenings to the community of Duluth will be evaluated by surveillance of the participation of the community residents. To get a clear picture of the overall acceptance of the service, we will have residents sign in upon entrance into the health fair. Individual partners, such as the community health nurse and the nutritionist, can evaluate their interventions by keeping a record of participants that actually participated in the services offered at the health fair. When residents are found to be already diagnosed with imbalanced nutrition more than body requirements, we will refer them to their provider for a follow-up care. And then we'll also follow up with the resident within 1 week to determine if health literacy was successful and that they were able to contact with their doctor. In both interventions, it will show the level of active health promotion in our community. I understand that with any intervention, there's a possibility that the goal will not be met. In this instance, I will gather information from my WIC program participants to see if any barriers exist that will be preventing them from obtaining free nutritious food with my health screenings. I will increase exposure to the events by advertising on local grocery stores and also on social network sites. Now that we went through everything, I want to kind of conclude everything. We went through the windshield survey, we did a community health assessment, we talked about the diagnosis, and I'll just reiterate that. So the diagnosis is risk for imbalanced nutrition more than body requirements. So our goal to help decrease that risk is to provide education and nutritious food options to the community residents of Duluth. We'll be doing that by working with the WIC program, offering women, children, and infants food free every month. And then we'll also be holding a bi-monthly health fair at Georgia parks and recreational centers. It's free. You come in, you can see a registered nurse, get your blood pressure taken. You can talk to a nutritionist about healthy food options. It's totally free. So that's the plan. And to evaluate that, like I said, with the WIC program participants, we'll look at their numbers. We'll look at the body mass index, see how it is. Is it going up? Is it going in the right direction? Is it staying the same? And then we'll also be making sure that they're actually getting the foods that we're providing them each month. Now with the health fair, we'll evaluate that by the participants that come to the health fair. Okay, now performing the windshield survey, it can definitely help you identify the needs of the community, and the assessment can give you a diagnosis by allowing you to analyze the information gathered. A diagnosis can be the foundation of your goal, and with the effective community partners, your outcome can definitely be achieved. Implementing change requires that you carefully outline your problems, importance of the problems, possible interventions, and chances of a successful outcome. And you also want to make sure that you note how the outcome will be evaluated. Healthcare providers play a major part in identifying needs of the public, so it's crucial that we continue to work collaboratively on all levels, to ensure that people in this nation stay healthy, especially when the disease can be prevented. The quality of life for one person can affect the quality of life of us all. We have to make sure that we stay up, stay healthy, and stay attentive. Each intervention success will be evaluated separately and then joined together to determine if the goal has been met. We will start off by partnering with Gwinnett Medical Center Duluth, which will be the hospital that we will get data from. Now the data will be baseline information to help us understand the current impact of residents who currently are diagnosed with imbalanced nutrition more than body requirements. This will give us the ability to monitor this data for increases once our intervention has been implemented. The intervention of providing WIC program participants with nutritious food options on a monthly basis to decrease the risk of imbalanced nutrition more than body requirements will be evaluated by the results of their biometric screening that will be performed every 3 months. This will help us to determine the success of the program and how beneficial it is to the population. The results of this data can also bring exposure to outside organizations willing to donate funds to a great cause. The intervention of providing free bi-monthly health screenings to the community of Duluth will be evaluated by the surveillance of participation in the community residents. To help get a clear picture of the overall acceptance of the services, we will also have the residents sign in upon entrance to the health fair. Individual partners, such as the community health nurse and the nutritionist, can evaluate their intervention by keeping a record of the participants that actually participated in the service we offered. Once the residents are found to have already been diagnosed with imbalanced nutrition more than body requirements, we will refer them to their provider for follow-up care. We will also do a follow-up call with the resident within 1 week just to make sure that they do have all the information needed to go see their provider and that the health literacy was successful. In both interventions, it will show the level of active health promotion in our community. I understand that with any intervention, there's always a possibility the goal will not be met. And in this instance, I will gather the information from the WIC program participants to see if any barriers exist that will be preventing them from obtaining their free nutritious food on a monthly basis. And then with the health screening exams, with my health fair, I will increase exposure to the events by advertising in local grocery stores and on social network sites. Now we're pretty much, at the end of the plan.